personally believe that a multidisciplinary approach is a huge advantage in providing second opinions, whether they are done locally or internationally by electronic telemedicine. The multidisciplinary approach simply accesses more expertise. By being able to reach out to specialists around the world who have the exact expertise necessary for a particular problem, patient care is simply better than it was before we had this capability.
The multidisciplinary approach to rendering a second opinion is critical. We do not operate in vacuum. And when we see a patient, we rely upon our radiologist to give us the right radiologic interpretation. We rely upon the pathologist to give us the right report. We depend upon the hematology consult to tell us what the bone marrow looks like. We depend upon the cardiologist to tell us what the cardiac function is. And we try to make the best judgment as to what is appropriate for the patient based on all of these input.
It allows a physician who's not directly involved in the day-to-day care of a patient to step back and really look objectively at everything going on with the patient's care.
Well, the benefit to a referring physician from any second opinion, whether it's done face-to-face or this way, is that you have a second pair of eyes looking at the same problem. And all doctors tend to get a little bit of tunnel vision.
Being able to take a helicopter view of what's going on would oftentimes be very different than working on the front line. So it's easier to direct traffic from the helicopter.
Complicated diseases require interdisciplinary teams of doctors with different backgrounds. It's very unusual for a primary care physician, for example, to be expert in every part of the body. But by being able to access second opinions, they can extend their own knowledge and actually learn from the consultant at the same time.
Large amounts of data were easy to obtain and download in a secure environment. So I thought that logistically it was very well planned and thought through.
We have been working for the last 15 years providing electronic second opinions to patients around the world.
I work in a branch of medicine where there's not a lot of expertise or it's concentrated in a few centers only, so that in many cases a patient's primary physician or even a general endocrinologist may not have sufficient exposure to these patients to have a complete understanding of the situation. So I find it positive that I think that I can help them formulate a more effective plan.
Physicians around the world taking care of patients benefit tremendously by having access to the very best experts who can help them and can be partners with them in taking care of their patients.
The fact that in a lot of instances we're able to change how the patient is going to be managed is extraordinarily unique.
Even without traveling, I have the opportunity to hopefully have a positive impact in their lives and health.
Every doctor wants to help patients. And the idea in the electronic age that we can reach out and extend our expertise, our special knowledge to help patients in different countries is very, very satisfying.